Welcome everyone. Thank you for attending my presentation today. My name is Boris Patent, and today we're going to be discussing something called ABA. My company is Brighter Mind Therapy, LLC, and we provide ABA services. Now, not many of you have heard of ABA, I'm sure, unless you have kids or know somebody who has kids with special needs. But we'll get to all of that into the presentation. First, I want you to picture a scrawny little 19-year-old, still in high school, working at Abercrombie & Fitch, thinking he's going to be a lawyer. Well, that was me, back in 2007 when I first heard about ABA. Now again, I said I was going to be a lawyer because I never thought that my life would bring me down the road of special needs care or therapy. All I knew about it at that point was that there were classes in my high school with kids who had special needs. Never did I think I'd actually get involved in it. But it has now become my mission in life to help families who struggle with having kids who have special needs, but furthermore, helping all sorts of people who need positive change in their life. And I want to talk about how ABA can help accomplish that. So again, the name of my company is Brighter Mind Therapy, LLC, and today's presentation will be an overview of ASD and our approach to treatment for all sorts of different diagnoses. What is ABA therapy and how does it work? Well, ABA stands for Applied Behavior Analysis, and it's a therapy based on the science of learning and behavior. It's used to improve social skills, communication, and learning skills by applying reinforcement strategies. Now, who here has heard of reinforcement? Oh, okay, good. So we're going to talk a little bit more about that. So reinforcement is a big part of ABA, and I want to get into that with the next slide. But basically, ABA therapy involves breaking skills into smaller steps and using reinforcement to encourage positive behaviors. So basically, we want to increase good behaviors and decrease problematic behaviors. And that's pretty much the entire point. Now, the thing that makes ABA stand out from other forms of therapy, and the reason it is scientifically based and approved by insurance as a therapy that's actually medically viable, is because we collect data. Data collection is a huge part of ABA therapy. And we use that data to then refine our treatment plans so that we can better help the client, the families, and we'll get a little bit more into that later as well. Let's start with talking about reinforcement. Reinforcement, what is it? Well, it acts in the reward pathways to strengthen the behavior that is being reinforced. There's two kinds of reinforcement. There's positive reinforcement and there's negative reinforcement. Positive reinforcement is any time that you add something to reward a person for their behavior. An example would be, good job, little Bobby, for cleaning your room. Here's a cookie. That's an example of positive reinforcement. You are giving something to someone as a reward. You're adding something in. The other form of reinforcement is negative reinforcement. Now, a lot of people confuse this with punishment because they hear the word negative, but that's actually not the case. Negative reinforcement is when you take something away, but it still acts like a reward. Let me give you an example. Little Bobby, thank you for cleaning your room. You know, you did such a good job today. You don't have to actually vacuum or do the dishes. I'll do that today. Great job, give me a high five. So what happened there? We're using negative reinforcement to reward Bobby by taking away unpreferred tasks such as vacuuming or washing the dishes. Still acts like a reward, but this time we're taking away. So that's reinforcement. And we'll talk a little bit more about why that's important. This now leads to behavioral shaping. Now, what is shaping? Anybody want to tell me what they think shaping might mean without reading the definition? What do you think it means? If you were going to guess, somebody.
Molding of some sort.
Yeah, good. Molding. So perfect. When we're shaping behavior is basically we're molding behavior over time for it to fit a particular, what we call a topography, which is a fancy word of saying basically a new pattern of behavior. Now, shaping is where we use reinforcement to guide the person into preferable behaviors and steer them away from non-preferable behaviors. So for example, If every time little Bobby screams, Mom, Mom, I want the iPad, give me the iPad, and every time the mom gives him the iPad, guess what? He's gonna keep screaming for the iPad because she keeps rewarding him for the screaming. So part of what shaping does is that it removes reinforcement for behaviors like screaming, grabbing, any type of inappropriate behavior, and we replace it with new behaviors, more functional behaviors. Hold on, guys, I just need a second. It's been kind of a while doing that.
No.
What?
No. Yeah. Good job. I'm good.
Well, that's a good example of replacement behaviors, you guys. Replacement behaviors maintained by positive reinforcement. Now, what did he do? He replaced the cigarette with something that's just as functional, like a lollipop. Creates the same kind of oral fixation fix that a cigarette might. Obviously, it lacks the nicotine, but it's close enough to maybe help break the habit. Now, what does it mean when it's maintained by positive reinforcement? When he gave me a fist bump and said, great job, that is a form of verbal praise. And verbal praise is actually the best form of positive reinforcement because we don't always have tangibles on hand. A lot of kids, they want the iPad, or they want Legos. Well, if you're on a road trip to Wisconsin, you're not always gonna have Legos. What if the iPad runs out of batteries? What do? Verbal praise is something you can always have on hand for free, and a lot of kids really enjoy it. Something like a high five, a sticker, whatever it is that they prefer is a great form of positive reinforcement to help shape behavior. So when we're shaping behavior, we always need to understand what the functions of behavior are. Now there's 4 major functions. All behavior, thousands of millions of different behaviors, only have 4 major functions. That's attention seeking, seeking tangibles like objects or items, escaping or avoiding something, so like it's time to do homework and the kid runs away, so that's a behavior maintained by escape. And then sensory seeking or automatic reinforcement. So a lot of kids engage in self-stimulation that most people would refer to as masturbation, and that is a form of automatic reinforcement maintained by sensory reinforcement. So we always want to identify the behavior we want to change. What is that behavior? Secondly, we want to define the behavior that we're going to replace it with. But to do that, to understand what behavior we need to replace it with, we first need to understand the function. And that's why we use board-certified behavior analysts who have gone through over 1,500 hours of supervision time, have a master's degree, and passed a board licensing exam to learn how to identify the functions properly. And sometimes there's multiple functions. Sometimes it's attention seeking and escape. Sometimes it's gaining intangible and sensory. So there could be multiple functions at play, which makes it a little complicated sometimes to identify. Thirdly, we want to figure out the series of small steps. So if we have a complex task like tying your shoes or taking a shower, getting dressed, etc., we want to learn how to break that down into smaller steps that the client can understand. And the way we do that is we use something called a task analysis. A task analysis is a fancy word for just basically saying directions. It is a list of directions, such as, for brushing teeth, it could be something like, first, pick up toothbrush. Second, pick up toothpaste. Third, open toothpaste, and so forth. And we have RBTs, that stands for Registered Behavioral Technicians, coming to the home, working with the kids on doing these things so that the kids have the guidance and the consistency they need to actually retain these new skills that we're teaching. So fourthly, set your child up for success. Now, what does that mean? It means picking goals that you know they can accomplish. You don't climb Mount Everest without ever learning how to climb a hill or on a playground. You start small and you work your way up. And that's what makes it so important when you work with different professionals to understand that the professional really needs a good idea of what your child's capacity is for learning so that they can break those things down into steps your child can understand. Now, finally, positively reinforce the child after the behavior. This part is critical, you guys, because you want to reinforce immediately. If you wait too long to reinforce the behavior after it's occurred, the child doesn't understand the connection. So imagine you did something kind for your girlfriend And then 5 months later, she says thank you. And then you say, for what? Well, now she has to remind you what she thanked you for. You want to say thank you right away. Thank you for the flowers. Thank you for dinner, so that it's connected with the event. So anytime you're doing positive reinforcement or negative reinforcement, you want to do it immediately after the behavior so that the child can always connect it to what they just did. Effective behavior reduction techniques. Okay, so we talked about positive reinforcement strategies. That's encouraging desired behaviors by rewarding them consistently. And this works, okay? Then we have something called functional communication training. Now, a lot of parents, they deal with kids who throw tantrums, who grab items off of shelves because they want them, or they run away without warning. Why does that happen? Why does a child choose to do that instead of just communicating what they want? Well, they lack functional communication skills. Most maladaptive behaviors are linked to a lack of functional communication skills. So one of the goals of ABA is teaching functional communication skills so that we can reduce the problem behaviors, because many times the problem behaviors occur due to a lack of an ability to communicate. So instead of a child wanting his mom's attention by saying, hey mom, can you come here? The child may start screaming or throwing something to get this mom's attention. And if we work on functional communication training, we can not only help the kids learn how to self-express better, but we can teach them how to cope with their behaviors by using language instead. Now, we also have data-driven decision-making. So as I mentioned before, ABA is very heavily reliant on data collection. So basically, during every session, we have data that we collect by the therapist, and then the analysts later review the data and update the treatment plan based on the input that they're getting from the therapists. Now, assessing behavior patterns for improvement to create more effective customized treatment plans is what makes ABA so effective. We do not have a cookie cutter method or one treatment plan that we use to help kids. We constantly refine it. Even maybe a bi-weekly basis, the analysts, if they're worth their salt, are gonna sit down, look at the data, review it, analyze it, and update the treatment plan to make it even better. And this is, one of the reasons ABA works, is that we don't rely on one treatment plan. Just like many doctors, they may just prescribe a medication and here you go. Well, imagine a doctor who every 2 weeks decides to refine the dosage or try a new medication, or do something different to make it even more effective. And that is the goal of ABA. We want to be effective. These families come to us with a lot of hope, and they don't know what to do. And our job is to create that positive change that they are praying for, really, ultimately. What is parent training? Well, a lot of parents expect therapists to come to their home, their insurance covers the therapy, and the parents just want to be unplugged. Hey, I got this person here, that's what I pay you for, they do the job, I can stay the same. Well, what parents don't understand is many times they actually have to change their behavior as well. So therapists only spend about 3 to 4 hours in the home, and the rest of the time the kids are still with their families. So we often do parent training to train the families to stay consistent with the child's treatment process when the therapist is not around. What does that mean? Typically, parent training involves teaching skills that parents can implement on their own when spending time with their kids. So about 1 hour per week, insurance allows for BCBA, the Board Certified Behavior Analyst, as I mentioned, to either call the parents, do a virtual meeting, come in person, or email documents related to different activities their kids can do, different techniques that they can use in the home to help reduce behaviors, and building leisurely skills, communication skills, etc. So that the parents can be doing the same thing that the kids are doing with their therapist. Now, anybody know what we call this? Anyone? Bueller? Bueller. We call this, it's going to take me a second now I lost it. No. We call this generalization. So generalization is basically when we teach a skill to a child in a particular setting with a particular person. And then we use it across many different settings with different people. So if we teach a child how to work with their therapist on identifying the number 3, we want that child to identify the number 3 with their teacher at school, with their mom and dad at home, and with their friends on the playground. And we call that generalization, where the skills are generalized across many settings and many different people. So parent training can be, again, in person, virtually, via telephone, depending on the situation. We always try to make it convenient for the family. Parent training can also include video links, reading materials, or other forms of information. So a lot of times parents are busy, they don't have time to do a weekly phone call or meeting with the BCBA. But it is wise to always maximize on that time that they get approved. So what we do is we then email them documents, like I mentioned, the task analysis on how to tie shoes, different materials the parents can have in the home. We always find a way to make sure that parents feel prepared when the therapist is not around. Key concepts of parent training. Understanding behavior patterns and functions. So again, we talked about the functions of behavior, and we want to teach parents to identify the function too, because new behaviors appear all the time, and it's important for parents to be able to quickly identify why the behavior is occurring. So again, that means they have to pay attention to patterns so that antecedent strategies can be developed to reduce frequency of problem behaviors. Now, speaking of patterns, let's go a little bit and talk about the history of ABA. The father of ABA was a psychologist named B.F. Skinner. And you may all know him as the father of operant conditioning, and he was the guy that taught rats to press a button to get a piece of cheese. So every time they press the button to get a piece of cheese, they learned that pressing the button will get them what they want. So he used operant conditioning to get them to change their behavior. Pavlov, a physician, did similar things using classical conditioning, where he would ring a bell and get a dog to salivate after pairing it with food. So we use different conditioning techniques to basically modify behavior over time, okay? And all of this actually works with other people too. So if you're ever in a relationship where you want to modify someone's behavior, you can always use the same techniques, you guys. This saves marriages, I'm telling you. Anyways, we move on to the strategies for consistency. So consistency is huge. We have to be consistent anytime we're implementing conditioning and reinforcement, especially in the beginning. So implementing techniques across various situations, like I said, different settings, different people. Staying consistent with expectations and reinforcement. Again, the child needs to know what they're expected of to know how to behave. And they also need to know what they're going to get in return. Just like when we go to a job, we want to know how much we're getting paid per hour. We want to know if there's benefits. Same for the kid. He wants to know what's in it for me if I do all this stuff I don't want to do. And that's natural. So we always want to use something called preference assessments, which basically helps us understand what the child prefers as a reward. And we can do those every session. There's different types of preference assessment, but long story short, it's a way for us to identify what the child prefers as a reinforcer. Finally, we get to effective communication skills. Fostering better interactions with your child. A lot of parents will spend time in a different room, and their kid will be in their room on their iPad for hours, because there's no connect. Parents don't know how to connect with their child sometimes, and this is very sad, because I've seen this before with families that had kids that they've lived with for nearly 20 years, and they still don't know how to connect with them. So one of the reasons we work on communication, and one of the reasons we do parent training, is so that we can help them bridge that gap, find that connection, and cultivate that relationship with their child that they've been yearning for all these years. I mean, this is huge, you guys, huge. We use different methods to help them communicate. So some kids are verbal, partially verbal, and then we have your nonverbal kids. So the verbal kids are actually great because they can speak and they can use speech language to communicate what they need. But then we have the partially verbal and nonverbal kids. And what that means is that they have very limited speech capacity, or they have the capacity, but they haven't been trained or aren't motivated to use their speech. So in that case, we have tools. We have something called PECS, which is the Picture Exchange Communication System. Very simple. It's a list of pictures, bathroom, banana, apple, car, and then when you ask them what they want, they point. This is an old-fashioned approach. They've been using this for quite a while. Now, as technology improved, we eventually got something called an AAC. That's an alternative augmentative communication device. So that is basically like a tablet that has similar pictures that they can press. It's digital. And then also they can type on it. It has a keyboard. We also have letterboards, which is very similar, but instead of it being a keyboard, it's just a, like a slide of letters, and then again, you have them point. I don't know if anybody saw Breaking Bad. Anybody? Okay, this guy. So remember, who was that old guy in the wheelchair? Was it not Gustavo? The old mafia guy. Yeah, so remember he had that letterboard where he used it to communicate? So that's a letterboard. And we actually use that for kids that sometimes struggle with fine motor skills, because using the keyboard, you have to be more precise with it. And when you use a letterboard, because it's not digital, a lot of times you're not really having to press a button as specifically, you can kind of generally point to it. And then we have ASL, that's American Sign Language, okay? So that's, I'm sure everybody's heard of sign language, right? Popcorn, right? All these, yeah? So that also helps kids communicate. And we try to use all of them, all these tools, to help them have as many capacities to communicate as possible. Practical applications of ABA. Enhancing skills for everyday success. Social skills, organizational skills, executive functioning skills, leisurely skills, daily living skills, independent play skills. These are all things that we take for granted as neurotypical people. Kids on the spectrum and other developmental delays, they struggle with this. Just like you or I may struggle with rocket science, they struggle with these types of more, what we consider maybe basic or intuitive skills. Improve family life. How many families I know can't go to the movies, can't go out to eat, can't have a date night because they can't find a person who's able to take adequate care of their child due to their behaviors. They can't bring their child to the movies because the child can't handle the sound, can't to go to a restaurant because the child can't wait for the food. We want to help people have a more normal, neurotypical, enjoyable life. So a huge part of ABA is helping not just the child, but the whole family heal. And this is paramount because a lot of families, they really get affected by having children with autism and other special needs. Increased learning. Increased learning is extremely important because once you start doing ABA with kids, you're now stimulating their brain cell production, and you're creating new pathways in their brain. And that's one of the reasons consistency is so important, is to create new pathways in the brain. We have to consistently train those new pathways and reinforce those new pathways so that they stay that way. And there's many different things that ABA can do. It can help improve the behavior in class. So a lot of kids wish that they can sit still and learn. We can help kids with ADHD, oppositional defiance disorder, all sorts of issues.
I've got a quick question.
Yeah.
What does like a standard session look like?
Oh, that's a great question. So a standard session, basically we customize the sessions based on the scheduling of the family. So typically kids go to school till about 3 o'clock, and we'll either do early morning sessions where the therapist comes and gets them ready for school and transitions them there. Or typically, most often, we work after school where the therapist greets the child after they get home from school, help them transition into the home. They do different activities. Where does your bag go? What should we do with your shoes? How do you use the bathroom? Why don't you go and do that? And what did you forget to do? Oh yeah, wash your hands, good job. So walking them through those daily living skills is partially what we do. And I'm glad you asked that because it's a perfect slide. So we typically create the sessions, they're 3 to 4 hours. ABA is very intensive, so anytime you're conditioning behavior, you want to be consistent and you need as much time as you can to spend with that person so that you can actually shape their behavior effectively. Spending 1 hour a week or 2 hours a week with a person isn't going to create that long-lasting change that you need. So what we need is about 5 days, at least 4 to 5 days per week at 3 to 4 hours per session to really spend enough time to condition the child into new behavioral patterns. All behavior is patterned, okay? If you think about it, it's like we're all weaving a web. And every day we weave a different part of our web, but if you look at the bigger picture, we're weaving one big web of our lives. And what we're doing is we're basically teaching these kids to weave a more intricate, organized, and beautiful pattern for their life so that they can become more functional. Because the pattern that you weave is a reflection of your life in general. If you're weaving, a pattern that's not symmetrical, not even. It shows that clearly there's something lacking in organization, maybe needs to be refined. So ABA therapy can help any person who wants to change their behavior, but it's mostly approved by insurance to treat symptoms of autism. Now, it's unfortunate that it's only approved for primarily kids with autism because, I think one of you had a question earlier about something like who else this was for. Was that you?
Yeah, I have a cousin that struggles with weight loss, but also struggles a little bit with depression. And I was wondering if ABA helps that sort of thing.
Yeah, so that's a fantastic question. So a lot of people think of autism when they think of ABA, but realistically, ABA can help treat any type of maladaptive behavior. Now first, let's get back to behavior. What is it? Behavior is anything you do, including thinking. Even thinking is a behavior, but ABA doesn't focus on internal states. ABA actually focuses on something called observable behaviors. So that's only what you can observe. So we can't in ABA ever make inferences about how someone is feeling inside. But what we can do is we can basically identify what their visible behavior is to be able to process whether that's adequate or not. So basically, it's used for autism, but it's effective for anybody. So for somebody like your cousin who struggles with weight gain issues and eating disorder, depressive states, we use the same exact template in terms of reinforcement, shaping, creating treatment plans, etc. Only we change the type of goals that we have. And one of the goals could be for weight loss, could be maybe moderating caloric intake. Maybe changing an exercise routine, creating an exercise routine with goals for a certain number of minutes that a person can exercise. For depression, creating small motivators that can help lead the person to want to be more motivated to take a shower, or go to the grocery store, etc. So yeah, do we have another question back there?
I was wondering, you can use it also for things like tantrums?
Yeah, so tantrums is one of the most frequent behaviors we experience with kids on the spectrum, but also all sorts of people. I mean, you can help, there's people with intermittent explosive disorder that aren't autistic. There's people who, when they struggle with alcohol abuse, can have tantrums. And we try to work on all of that, and we use, again, the same principles, but we just apply them in a different way. So ABA can help anybody, drug addiction, again, weight loss, eating disorders, depressive states, maybe certain conditions like schizophrenia, bipolar disorder. Those might need some additional tools like medication and some additional professionals. In ABA, we do not administer medication, but we do closely work with other professionals that do. And we always collaborate with psychiatrists, occupational therapists, and so forth, to try to get the best information we can about the client and keep everything on the same page, keep everybody on the same page. Again, this leads back to generalization. We want the client to have consistency in any setting. Early intervention programs. So a lot of times autism is diagnosed at about 2 to 3 years old. So early intervention is exactly that. We want to start providing ABA therapy as early as possible. The earlier we start, the more effective it is, the more likely you are to see progress. And obviously that's because the brain is still developing, but when you get a head start on anything in life, chances are you're going to be more successful. And that's exactly what we try to do. So adults can also receive ABA services, but many times adults have had it before, and many times adults, unfortunately, due to their age, their brain isn't developing at the same rate it was when they were younger. So results end up varying. Oftentimes they're not as effective as when the child was younger, and unfortunately, due to insurance looking at clients as an investment on their part, they sometimes don't want to approve the hours or as many hours for ABA as they would have if the child was younger. They see a higher potential in growth with a younger student. So, but we always advocate for our clients, and I personally call these insurance companies and go back and forth with them trying to push for more hours because these kids deserve it. These kids deserve it. So, thank you. Does anybody have any more questions?
I have a question.
Oh, yeah, okay, ladies first.
Going back to working with the parent, what if the parent isn't there? Or can you do it with like the grandparent?
Yeah, so parent training isn't necessarily just for the parents, it's really for the guardians. It could be the parents, could be the grandparents, it could just be an aunt and uncle who would take care of the kid. Whoever is in charge of raising the child and spending the most time with the child is the person that we want to be doing the parent training with. I think parent training is one of the most important parts of this because again, when the therapist leaves, if the child, for example, if the therapist is working on not giving a child an iPad every time the child screams, and they're finally making progress, and the child is finally using their words to ask for the iPad instead of screaming, and then the therapist leaves, and then the kid screams and the parent gives them the iPad, they just undid all that work that the therapist was working on. Now the kid's screaming again and getting the iPad. So we always want parents to be trained on using the same reinforcement techniques as the adults, as the therapists that are working with them. And we get in touch with the school, we try to get an IEP plan, we want to be on the same page, we always communicate with the school districts, with the families, and with the other professionals. Now a little bit more about myself. Over the years I've been trained in many different things. So not only have I been formally trained in ABA, but I've been trained in physical and occupational therapy. I've been trained in behavioral optometry. I've been trained in rapid prompting method. I've been trained in floor time. I've been trained in sunrise. I've had the honor of learning a lot of different therapeutic approaches to working with people on the spectrum and people with sensory needs and sensitivities. So over the course of these years, the reason I stuck with ABA is because I found that ABA has kind of an umbrella covering many of these different things. We can do exercises that relate to occupational therapy, to speech therapy. It can cover many of those different things. But I used my learning and all the knowledge I gained over the last 19 years to start this company, Brighter Mind Therapy, so that I can help more families, have more seminars to have people like you attend and learn more about ABA. And I hope and encourage everybody to, reach out to people that may need help and to look into opportunities for a career in ABA. It's actually a growing field, and I think that there's a lot of room for great people to come and help. So, does anybody else have any thoughts, comments? Yeah.
I guess the question would be, with any clients, have you seen any like night and day differences over a long span of time?
Long span of time, yes. Short span of time, sometimes. So with the long span of time, unfortunately, some of this does take time. Not all of it happens overnight. In fact, it almost never happens overnight. So one thing I wanted to mention was there's something called an extinction burst. What does that mean? Extinction, everybody's heard of it. What does that mean? It means something's disappearing, right? So when we put behaviors on extinction, that means, for example, when little Bobby screams for his iPad, and he usually gets it, putting that behavior on extinction means now he's not getting his iPad anymore every time he screams. And he's gonna scream, and you don't give him the iPad, and what's gonna happen? Will he stop screaming? No. In fact, he's gonna start screaming louder, more frequently, and that is an extinction burst. The behavior increases before it decreases. So a lot of times when we do interventions on kids, the parents say something like, hey, you said this was gonna help, but the behavior is getting worse. Is this working? The answer is yes, it's working. And in fact, that's how you know it's working. It's getting worse because that means it's gonna get better soon. It goes up before it goes down. And that's one of the ways that you can tell that it's gonna work. But again, you wanna reinforce the child and create replacement behavior. So instead of the screaming, you want your iPad? How can you ask for it? Good job saying, can I have my iPad, please? Yes, you can. Here you go. Thank you for using your words. And now the child learns that using their words gets them the preferred item as opposed to the screaming. But the key is never to reinforce the screaming, you guys, because that's always going to lead to more of that behavior. Anytime you get reinforced, you're going to continue to do that behavior. Now, the problem with that is also sometimes the behavior can be very reinforcing. You know, like when you think of drug addiction, using drugs in and of itself is a reinforcer. You feel good, so it reinforces that behavior. So it's very hard. How do you break that pattern when the drug feels better than a high five? Well, that's when we come up with replacement behaviors. And we come up with things that are, have a higher safety profile to maybe replace something more negative with something that's safer. So it's not always about abstinence or zero tolerance, even with kids on the spectrum. Sometimes it's okay for them to throw an item, but maybe we can make it safer and more functional, such as take that ball and why don't you throw it at your pillow and pretend that that ball is all your frustration for today, and throw it at the pillow and imagine that was your frustration and now it's gone. Well, that's a functional way of using something like throwing to do a therapeutic approach, and it's safe and it's controlled. But typically, again, with throwing and things like that, we try not to even encourage that kind of behavior, because then kids have a tougher time differentiating between times they should be throwing something and times they should not. So that's a great question. Anybody have any other questions?
I would say maybe like how do we know if our insurance covers the service?
That's a fantastic question. So one of the things you want to do is you want to give us a call, or you can write us through our website. That's www.brightermindtherapy.org. And basically, we're going to schedule an appointment with you. We would ask you basic questions about whether, how old your child is, where you're located, what their diagnosis is, when the last time they were diagnosed, what kind of insurance you have, what kind of hours you were looking for scheduling. And then after that, we would call your insurance provider and check your benefits to make sure that it's covered, find out what the steps that specific insurance company needs to apply for authorization of ours, and then we collect all the data. So any medical records, sometimes they want a prescription from a physician for ABA, something like I'm the child's physician, I recommend them for ABA services. And this all helps insurance, this all helps substantiate the claims that this child needs this from insurance. And then we do assessments. So a lot of times we'll send something called a Vineland, which is a questionnaire to a parent to fill out about the child's daily living skills, capacities for reading, writing, etc. Other times we'll do an assessment where the BCBA comes in, and they're going to be the ones who sit with the child and probe them by asking different questions. Point to this, what's that? Find color blue, touch your nose, different things to just assess what their capacity for learning is and what their skill set is. Then after that, we submit a treatment plan that's customized to the child, and we submit all these things to insurance, and typically within 2 weeks they approve it, and we find out how many hours we get. Typically it's between 20 and 30 hours. And at that point, we have 20 to 30 hours per week. We can just start scheduling sessions as needed, and we find an RBT who's located. Again, RBT is Registered Behavioral Technician. That's a person who's coming to the home directly to work with the child or whomever. And they're the ones that come. We find a local person, and they arrive there every day. The BCBA does supervision, so they supervise that RBT, and then they give them feedback, train them, and refine the treatment plan on top of that. But those aren't the only services we provide. We do parent workshops, and this is not just for parents with special needs. This is for parents of kids who have behavioral issues, who have frequent fighting in school, drug use, alcohol use, non-compliance, tardiness at school, skipping school. We can help parents overcome some of these things with their children. Also, just new parents in general. People in their 20s or 30s having their first child don't know how to work on toileting, don't know how to work on food, don't know how to work on behavior. We can teach new parents of any child on how to start up being a parent adequately, and how to overcome some of those hurdles that new parents face. Furthermore, we do telehealth therapy services. We call it life skills training. So for people that don't want a therapist in their home every day, and for people that this is typically not for autism, but this is more for people with depression, eating disorders, so forth, we can do about 2 hours per week, and we do that via telehealth typically. And it's more in a dialectical sense where we talk about things, we still create goals for them, and then we track their data and discuss how their progress is going. But this is typically with more neurotypical people that don't have autism, but still have issues that they want to overcome. So we provide a range of different services. We consult with schools, we provide one-on-one aids in the school setting, and ultimately, we're here to help the community, you guys. This is why I started the company. I'm really passionate about what I do, and that's why our slogan is ABA services by people who care. I care, and I want everybody to know that. So here I am presenting about my company, Brighter Mind Therapy. Give us a call. Feel free to ask any questions anytime. My name is Boris Patton, and thank you for attending my presentation.